Okay. Guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. Again, in the final exam, you might get a listening which is very easy and also one part can be difficult. So we have just executed a listening altogether. We have just done it. Have plus third form means we have done it. So we are just repeating it now in front of you guys. And this is the listening by OET Online. So really thankful. Again, Dr. BKM's part is to tell you how to do it or OET 2.0. Main thing is how to do it. So in the final exam, it's rare of the chance you will get an accent like this. But again, always be prepared. Always prepare listenings like this. So you will get 30 seconds in the start. So please try to understand the topic in the start, 30 or 60 seconds, but understand the topic. Problems, breathing dash, has felt dash. So you understand today my topic is around breathing. Problems breathing dash, has felt dash, started dash 12-18 months ago, serious fatigue in the morning, previous treatment. Do you know why these statements are given? These extra things are given so that you can write your answer. Then he would be speaking about this. Then previous statement from the chemist, so it will come as the name of the treatment. GP prescribed dash. Diagnosis, there would be a disease accompanied by dash. Then you will fill this. Recommended dash to align suggested course of action and what are the patient concern. So this listening is very fast, guys. So please be very active. And also one important thing that I'm telling you in the start. One, I have already told you, that you need to understand the topics. We understand breathing problem. This she's already taking some medication from the GP. Then now GP has given some course of action. And what are the concerns of the patient in the last? Second important thing, the most important thing, whatever two people are saying, you have to listen to the patient only. Very important thing. The blank will come from the patient. And never write words like my, because please understand, we are not these are very important. We are writing the case notes of the patient. We are the nurses or doctors, so we cannot write my. You might lose 1 or 2 marks just because of my word. So never write my. Very important instruction. Again, three important instructions. One, read it in 30 to 60 seconds, whatever the time is given. Second, understanding the topic, that comes a part of one only, understanding the topic. Listen to what patient is saying and never write my. Now let's get it going. Suppose in the final exam, time starts straight away and now you get the time. Okay. So that's gonna happen in the exam and they will start playing within 30 seconds. So I'm also. Why don't you? Now, whatever you miss because of this person is not a problem, because he cannot give you answer. We are concerned about the patient. What's being. Yes, that's right. I suppose I've always had some trouble breathing fully through my nose. So I have problem breathing fully through my nose. My word is not important. You should not write it. Fully word can be in the bracket. It's kind of an adverb. But the main word is problems breathing through the nose. Main word. So by chance, if you write fully or not, it will not change anything. But if you listen to the word fully, then always write. If you are not sure about the word, don't write. So in my case, I will write fully through the nose, but otherwise my answer is through the nose. If you write an extra word, that's not a problem. But again, if you listen to the word fully, it's better to write. Second. It's in my left nostril, but I feel like it's been worse in the past few years. I used to play a lot of sport, especially netball, but I've had to give it away because I was getting so terribly short of breath. So while it's there during the day, the blockage, it's even worse at night. When it's time for bed, well, sometimes the left side of. So, see, now she has spoken so fast, so fast. Now you hear the word blockage. But the bracket is saying gave up netball. Gave up netball in that, but this is our keyword. Like in reading and listening part B and C, Now, this is the keyword of this blank. Gave up netball. Because due to the netball, she was feeling short of breath. That is the main. Terribly short of breath. Again, terribly, it's not important to write, but I will make you listen to it one more time. Please understand. Especially for my left nostril. But I feel like it's been worse in the past few years. I used to play a lot. As I feel it has worsened in the last 3 years, but I have heard the word feel. I have heard the word feel, and I really want to write has felt worsened. But then the blank is given gave up the netball. That is where I am confused. Has felt worsened. Maybe that can be the true answer. Worsened and other blank other thing. Well, especially netball. I think it away because I was getting so terribly short of breath. I have to give it away because I was feeling so terribly short of breath. That is why I say listen to one listening 3 times. It will improve your speaking. Not only listening thought will definitely improve, but it will also improve your speaking. Do one listening 3 times. Next day, suppose Monday, you do one listening 3 times. Tuesday, don't do your homework. Listening. Wednesday, again, do one listening 3 times. But don't do all the listenings. But whatever listening you do it 3 times. It will improve your speaking, it will improve your understanding. So now I am confused. The first blank she said has felt worsened. Feel word came with worsened. But again, bracket is given gave up the netball. So she gave up the netball and other sports just because she was feeling terribly short of breath. So that is my main blank. So I'm choosing the next one. It might be the other one, but yeah. While it's there during the day, the blockage, it's even worse at night. When it's time for bed, well, sometimes the left side of my nose can feel completely stuffed up. My husband. So she's saying blockage when I'm sleeping on my left side, my nose completely stuffed up. Stuffed up means again blockage, stuffed up. So you will learn how to speak. So blockage, stuffed up. So any blank can come. But I am telling you again, it is not easy in exam because I've got 3 answers now. First one is worsened, second one is terribly short of breath, third one is blockage, and now fourth one is stuffed up. But I am choosing one thing due to my bracket, that is gave up the network. Please learn this thing. It might be wrong in this listening, but in the final listening, definitely that answer would be short of breath. Terribly, you can write it or you don't. But let's listen to it further. Been snoring as well. It started a little over 12 months ago, I suppose. I think it went away because I was getting so terribly short of breath. So while it's there during the day, the blockage, it's even worse at night. When it's time for bed, well, sometimes the left side of my nose can feel completely stuffed up. My husband tells me that I've been snoring as well. Now, this is the blank. My husband tells me about my snoring as well. Snoring is like, so snoring word is something that you should learn. So whenever you have listening like this, always write these words. Snoring is a very, very important word that you should write. Snoring, snoring. It is a problem in every kind of conditions like sleep apnea, breathing difficulty at night. You will always have snoring. All right. Started a little over 12 months ago, I suppose. Yes, probably 12 to 18 months. There is another rule that I can teach you again. That is what I'm saying. That is what, uh, we are all about being Dr. B chemisters. We teach you medical, we teach you English as well. English, now, where is English? After the word started, maximum time, ing will come. Ing means this is known as gerund. Gerund is kind of a noun. That means some activity will come. I started playing cricket. I started going to park. I started enjoying food. I started doing this activity. So ing word will come. 99% of the times. I started playing cricket or cricket will come. Noun is equal to gerund. Gerund is the word with ing that behaves like a noun. Noun, what is noun? Noun is like this pen is a noun. It's a complete entity. In the same way, cricket is a game. It's a complete thing. In the same way, started playing, it's an activity. Started snoring, started doing this thing. So after started, either noun will come or this ing will come. Always remember. So focus on the word with ing. When you have a word started blank, always focus on the word ing. Again, I will make you listen.
Especially netball, but I've had to give it away because I was getting so terribly short of breath. So while it's there during the day,
It's till now. Why am I explaining again and again? Every time I listen to this, I have not checked the answer, so I feel, oh, this answer can be wrong because blockage, stuffed up, this, and the first word that we chose can come. But I have filled the word, the second one, because it the in the bracket netball is given. So that is what my focus was.
it's even worse at night. When it's time for bed, well, sometimes the left side of my nose can feel completely stuffed up. My husband tells me that I've been snoring as well. It started a little over 12 months ago, I suppose. Yes, probably 12 to 18 months. Do you feel
Now there is another thing. Started over. Now see, that is what is the until now my word was snoring, but timings can also come. So now she's saying started over 12 to 18 months ago. But the problem is, I could have written the word over, but I am not writing it because it is not completing my case notes. Because snoring word is not given. If they would have given the word over here as snoring, let me use it. Suppose if over here they would have put a dot and would have written snoring, then my blank 100% should have been over. But I have to fill the notes now. Has felt dash, blocking of the nose, worse at night. But over word also she has spoken. In the final exam, you won't have confusion of this kind. So in the final exam, over word should be my answer. But for now, I am writing snoring because I want to complete the case notes. Again, I will make you listen. And that is what people say, oh, sir, I have done listening once. I remember all the answers. Nobody, it's not about answers. It's about learning. Now tell me whether snoring or overword, which is better. Now, let's see.
So while it's there during the day, the blockage, it's even worse at night. When it's time for bed, well, sometimes the left side of my nose can feel completely stuffed up. My husband tells me that I've been snoring as well. It started a little over 12 months ago, I suppose.
A little over 12 months ago, I suppose. So you also learn how to speak. So please, again, guys, if you want to pass in listening, one listening three times.
Probably 12 to 18 months. You feel tired in the morning? I do, yes. Um, Sometimes it can feel like I've hardly slept at all, and the back of my throat tastes like I've smoked a pack of cigarettes. I've tried some of those sprays, those ones that you can get from the chemist, those decongestants, just to try.
So now there is the name of the spray, which is very hard for me because again, I'm a dentist. If I would have been maybe MBBS doctor would have been or nurse would have been little more known to this thing. Maybe she's speaking the name of the spray, congestin or something, but I can only listen to the word spray.
Some sprays, those ones that you can get from the chemist, those decongestants, just to try and help clear my nose a bit. They used to work, but then after a while,
Something like congestin, some spray, maybe PK congestin or something like that. But again, in the final exam, if I cannot understand this word, I will write spray. That's the only option I have. Otherwise, this is an impossible blank to be done. So I will not get over worried about it.
they all stopped being effective. Then, when I first spoke to my GP about what was happening, she prescribed a spray for me. It's a combination corticosteroid antihistamine spray. It was
Now, if I write everything combination, so I only write GP prescribed. Otherwise, complete answer should be combination of corticosteroid antihistamine spray. Otherwise, the answer should be. But in the final blank, in the final exam, you can write only three blanks. So, three words. So, combination of corticosteroid antihistamine. You can write these three words. Combination of corticosteroid antihistamine. Combination of antihistamine, corticosteroid slash antihistamine. Then they will become one word. Combination of corticosteroid. I will write it down for you. See if I have to make these three words. Otherwise, corticosteroid antihistamine should be answered. But I'm telling you how to write if you are stuck. Combination of corticosteroid antihistamine. Yeah. Spelling. Okay. Yeah, spelling cannot be wrong because very important to write. So I made this slash to make this one word. So combination of corticosteroid antihistamine spray. Okay. Okay. Let's do the other one. So this listening is little tricky, but again, that is why I'm doing it for you and recording it.
I thought it was rather. She said I shouldn't really stay on that long time because she thought my issues were more structural.
No, whatever they are speaking is not important. It's your time to look forward to the next question because the next question is about diagnosis. Until the diagnosis word does not come in, you can think about these blanks or maybe you can read other books. But always look forward, don't go back. Whatever is left is left. You can only try and guess it. But now move forward. Think about this diagnosis.
Okay, great. You mind if I take a look? It's quite good, but it will allow me to confirm your GP's diagnosis.
Now this is the word. Now I focus more.
Well, the things like you would have been on this symptom.
Now that is what I was teaching you guys. If you get one chance, it's very hard to understand what he's speaking. But again, that is why again I always say have a medical professional as your coach when it comes to OET coaching. Because now we know this is nasal septum. And if somebody has a problem in breathing, it can be a deviated nasal septum. Otherwise, it is almost impossible to fill in this blank if you are not a medical professional. So always, guys, always learn from a medical professional and try to listen to this nasal septum. Septum is anything that is kind of a break, that is kind of a bridge that is in our anatomy. We call it septum. Okay.
Quite large turbinates as well. Right, okay. That's what.
And quite large.
Okay, thanks. Well, the things like you would have been on your septum. And you have some quite large turbinates as well.
Quite large turbonates as well. So I don't understand this word, but I will write accompanied by quite large turbonates. So I will take the risk of the spelling TARBONATs. I don't know what he has spoken. So again, there are sometimes listening, it will not be that tough in the exam. Again, I'm telling you, it will never be that tough. But through the nose was a hard blank. This was toughest. This was toughest because snoring or little over. What should I write? Not easy. A spray or congestive? Not easy. A prescribed combination of only fifth question was little easy. Positive deviated nasal septum again hard, accompanied by quite large turbonates hard. So obviously this kind of listening will not come, but still we are trying to execute. Let's do more. Let's finish. Now focus on suggested course of action. So suggested course of action, 90% should be told by the doctor. So this time patient should not speak. But our OET listening says always patient will speak. So maybe the doctor will ask the patient. So what was the suggestion? So focus on that word.
He said, wasn't it? Yes, it isn't so unusual. Almost no one with a completely straight nose. The issue is that yours is affecting your breathing.
Almost nobody has a straight nose. Again, when you do listening again and again, you learn how to listen. Almost nobody has a straight nose. Everybody has a bit of this, but the issue is that this is causing breathing problem in you. That is why we are talking about it. So the doctor is telling the patient, otherwise it's a common thing. But in your case, this deviated thing is causing problem. That's why we are having this. So what is the recommended course of action?
Changing how to to sleep. Oh, yes, that's right. Can you explain? Oh, yes. The first option is usually a very simple surgical procedure called a septoplasty.
Now, as expected, so doctor is saying septoplasty is the surgical. Again, plasty is any word that in medical domain we say plastic surgery. Plasty means any change in aesthetics. Angioplasty, this plasty, that means you are changing the structures. Plasty, this spelling cannot be wrong, Plasty. And in this case, it's not angio, it's septo, septum, septoplasty. So if you're not a medical professional, or if you are not learning from a medical professional, you will have this problem. So nasal septum, septoplasty, done. Rhinoplasty, this plasty, we all say it for the surgeries. Again, so now the word is recommended surgery. Again, I was thinking patient will say, but again in this, because it was a suggested course of action, so doctor has said septoplasty.
Surgery. I'm not so keen on that.
Now, this is the best thing you can learn from this. Everything was important what we have learned in this language. Gerund was important to learn. Blanks were important to learn. This listening might be tough, will never come in exam, but you can learn things. Because in the exam, one question will be tough. Then if you can do that one question also, it will give you more power. That is what we say. OET is a fight of 1 to 2 marks. Now, if you know what is the concern of the patient, patient's concern, so always 100% patient will speak about it. So what are the concerns of the patient? Now patient is speaking.
You're asleep. Yes, that's right. Can you explain? Oh, yes. The first option is usually a very simple surgical procedure called a septoplasty. Right, I see. Surgery. I'm not so keen on that.
Oh, I see. Surgery. I'm not so keen on that. That means I'm not really willing. Keen, Keen. Keen means interested. I'm not really interested on that.
The time I had surgery was on my knee. But
The other time I had surgery was on my knee. This is what I always teach you, not only in OET, any exam. Worried about surgery. Surgery is the word I can say. Previous complication, previous always means was. So the other time I had a surgery on my knee. So was or had is like the past words. So previous complication. Let's listen to it again. Again, guys, what I'm teaching is very important to learn what is OET listening and how to do it.
the first option is usually a very simple surgical procedure called a septoplasty. Right, I see. Surgery. I'm not so keen on that. The only other time I had surgery was on my knee, and it wasn't very successful.
Was on my knee and it was not successful. So previous complications with knee surgery because it was not successful.
What actually made it worse? Well, septoplasty is very successful and very common. It will allow me to straighten and align the cartilage structure that exists in the midline of your nose, and you'll find you'll be able to breathe much more freely after that. I just don't know if that's the way I want to go. There are
So in the foreign countries, patients even don't directly say no. Oh, I'm not sure. I don't think that's the way I would like to go. That means she's saying no. So when you become nurses or doctors in foreign countries, so that means if she's saying I don't think, that means she doesn't want it. And you say, oh no, 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 it's important. So you can't force the patients over there. So this is the way communication. So this is OET speaking as well. When patient will say, oh, I don't think, okay, don't worry, then it's fine. We will talk to the doctor again. But I would still like to recommend you, this is the best procedure that we can have at the moment for you because doctor has already analyzed that what is the requirement. So as per your conditions right now, this is the only surgery you should go for. This is how you convince the patient. Well, I understand that you are right. It can be little troublesome, but at the same time, doctor has already analyzed and after After looking at your condition, this is the best surgery for you. You can trust us. So that is how you convince the patient. Okay.
Perhaps less structural.
So he's saying other options we can try. So offer to outline other options, even if by chance you do not listen to any blank because concern word was never spoken. So you can miss all the blanks in one shot. But try to do some blanks with your common understandings. Offer to outline other options because she's not liking it. So he will always say offer to outline other options. And then you can remember a knee word was so complication with knee surgery. So these two blanks you can fill even if by chance you miss it in rush. And worried about surgery.
I can outline some of those if you like. Yeah, I just don't know. I can suffer with a bit of anxiety sometimes, you see.
I don't know, but I suffer with bit of anxiety sometimes. Sometimes suffer with bit of anxiety. Again, bit of is not necessary, but if you can write it a bit of anxiety, then it's good. So main word is anxiety. Again, you can't do spelling wrong. Anxiety. No spelling. So now, as promised, we will check the answer and let's see how many wrong, how many right, and that is how you do OET listening. You should know the rule of gerunds. It will help you. Then you have other things which you can learn. Let's see if the answers are given. I don't find answers anywhere. Yeah. Oh, this one. Through left nostril, but I think that she said through the nostril. But through nostril is the main word, fully word I told you is not important, almost all good. Shortness of breath, she never spoke. She said short of breath, so I will write short of breath. But both the things are correct. Short of breath or shortness of breath, both are correct. You can listen to it again. She has spoken short of breath. Snoring, that is what I told you. Decongestants. Oh my God, I know this thing. And you also know, I know because you are nurses and doctors. This we can now remember forever. Decongestants for the breathing problems. Decongestants. Now we will note. And also, just don't feel, oh my God, I missed, but write the spelling. So I'm writing in front of you DE congestants. Then I'm writing it 5 times. That is how you practice. Decongestants. Decongestants so that you never forget. That is the way to practice listening. So decongestants, cortico antihistamine spray that I told you, deviated septum I told you. Turbinate, I write the word TARBO, but there is TINAT. Rest, everything is correct. I'm not taking marks, but again, I try. That is what you need to understand. Septoplasty done, surgery done, knee surgery done. Less structural revision, I think the answer would have been other options, but yeah, other options was better. So I will not say this is the answer. And anxiety we did. So almost 10. Even after considering decongestants, terminate as wrong. Even then 10 out of 12 in this difficult listening. So we all can do it. Again, don't miss out on this link, this listening. Please, again, please listen to this listening at least 2 times completely. Then it will come into your subconscious and it will sink in your heart that you can take in your exam. Otherwise, you will listen to this listening once and will forget. And there is no use of it. Do only one thing one day. Speaking takes 10 minutes. Practice alone. Do one speaking 5 times. Speak in front of mirror again. Try to record your voice. That is to prepare. Then one day will become as good as 5 days. That means you will become 5 times faster. When you will do one listening 3 times, you will become 5 times faster. Trust me, if you do one listening 1 time, you don't gain anything. Learn speaking, learn OET listening in one day. Means do listening in such an effective way that you learn speaking as well from it. This is Dr. Bhupesh from Dr. BKM OET Institutes. Please subscribe our channel if you have not for your own good and contact us on 76967 34256 for the best OET coaching. Thank you very much.